Well, Bill and Candace, Dr. Avula is saying he's now aware of the complexities of this statewide program, but feels that the state is doing a good job so far, nearly a month into it, and thinks that in the coming weeks, our area could be joining that Phase 1B crowd.
What's clear is that this is the most complex logistical challenge we've ever faced.
Dr. Danny Avula describes what he's found in his first week leading Virginia's COVID-19 vaccination efforts as it nears the 1-month mark.
We have done a good job of getting vaccine to the 1A priority group.
And Monday, some districts in northern and southwest Virginia are moving on to Phase 1B. Avula says it's not so much other regions are falling behind, but a demographics-driven decision.
The vaccinating capacity and the demand for vaccinations among that 1A population have looked really different.
A part of moving forward means more vaccinations per day, and Avula says they're averaging about 10,000. He says it could take 6 weeks to get to the governor's first benchmark of 25,000 per day.
Hopefully it'll happen sooner.
Meanwhile, Avula says to increase vaccinators, they've been onboarding private clinics and pharmacies, which he says has been a clunky process with the CDC.
To date, we have about 1,000 private providers who now have been approved through the system. We have 170 or so pharmacies.
Avula says Phase 1B will be a mixed approach to vaccinations, where some groups like police get it at work, while others, like people over 75, may go to their provider or clinics. He says VDH has launched an online tool where you can find out when you're eligible, and it gives them contact information to reach out about clinics you can attend. But at the same time, Avula says they're also planning to get the vaccine to vulnerable communities.
Communities that don't have access to transportation, that don't have health insurance, and may not choose to go to a private provider or pharmacy because they think there's going to be a payment barrier.
And Dr. Avula says that movements into Phase 1B will likely be done at the regional level like Southwest and Northern Virginia just did, and said depending on how big this next shipment of vaccine is, that Central Virginia could begin the Phase 1B vaccinations as early as the beginning of next week. Working for you in Henrico County, Cameron Thompson, CBS 6 News.